Hello, my name is Aaron Blackham. I'm a licensed clinical social worker and I work as a behavioral health provider here at Community Health Alliance. September is National Suicide Prevention and Awareness Month. So we are here today to talk about some myths and truths relating to suicide and suicidal thoughts, and then finish by sharing some resources and some things that we can do for ourselves and others who may be at risk to suicide or having suicidal thoughts. So let's talk about myth number one. Maybe you've heard people say before that the only people that commit suicide or think about suicide are people who have mental health issues. That just simply is not the truth. The truth is that we know that almost every single one of us as human beings, at some point in our life, we'll probably think about dying. We'll probably think about what it would be like to not wake up the next day because we're in pain, because we're suffering. So let's talk about some of the risk factors of times when we're more likely to have suicidal thoughts. So first of all, there are different age groups that are more at risk of suicide. So we know for people ages 10 to 34, suicide is the second leading cause of death in this country. For people ages 35 to 44, suicide is the fourth leading cause of death. For females, the biggest risk for age groups are people who are age 45 to 64. For males, our biggest age group risks are for men ages 75 and older. And we know across the spectrum for all gender identities, the biggest age group are people ages 18 to 25. Other risks for thinking about suicide can be social risks. So when we've had social things happen in our life, for example, losing a job, losing an important relationship, going through a divorce or a breakup, losing a close friend or family member, or knowing someone else who has committed suicide can put us at greater risk of suicide. Other risk factors can be when people have severe medical needs, when people have severe physical or emotional pain, when people have an incredible level of suffering. These are times when we're at greater risks of suicide. So another myth is the belief that suicide often happens without warning. The truth is, more often there are warning signs. There's indicators that someone's thinking about suicide. So let's talk about some of the most common warning signs. So one warning sign can be if you notice any significant change in a person. They're not eating as they usually would. They're sleeping different. They're using more alcohol or drugs than they typically use or started using. Another warning sign is sometimes people start giving things away that used to be important to them. People expressing hopelessness, depression, being socially isolated, not spending time around people, or being out in the community as much as they typically do. People experiencing unbearable pain and wanting to end their pain. None of these individually are necessarily proof that someone's going to commit suicide, but they're all red flags and warning signs that someone could be having suicidal thoughts. Another common myth about suicide is thinking that talking to someone directly about suicide will increase the chance that they'll commit suicide. A worry that sometimes we're just better off not talking about it. We know that the truth is the opposite of that. We know that talking to someone directly and asking them, are you feeling suicidal? Do you have a plan to end your life? Direct communication is one of our best tools because it helps people talk about what they're thinking and what they're feeling. And talking about it helps when it's a conversation with someone that you trust or a professional. When we name it, we can tame it. So now let's talk about things that can help if we're having thoughts of suicide or know of someone else who might be having thoughts of suicide. So first of all is staying in touch with people, connecting with people, maybe just calling them randomly, maybe scheduling a time to have lunch or coffee or tea, helping people stay connected to their faith, their spiritual beliefs, their cultural practices. And like we talked about before, having direct communication with people if we're concerned and asking them if they're having thoughts of suicide. Now let's talk about some resources that are available for everyone out there in the community. If you're having suicidal thoughts, please call 988. 3 numbers, 988 is a national suicide crisis hotline with trained people who are available 24/7, 365 to talk to you when you're having thoughts about suicide. If you prefer texting, you can reach the same resource by texting 741 741. Also, there's a crisis line called the Trevor Line that helps with our friends and our family members who are part of the LGBTQ plus community. For those of you who are part of that community, if you'd like, you could also call 1-866-488-7386, or if you'd like to text, you can text 678-678. So please call those numbers if you're having any thoughts of suicide. Please talk with someone you trust. You can also speak with your medical provider. You could schedule an appointment with your medical provider. Our phone number here at Community Health Alliance is 775-329-6300. Also, anytime you have an appointment with your medical provider, you can ask to speak with a behavioral health provider like myself. So we know that it's great to talk about life, and it's also important to talk about death. And if we're having thoughts about death, it's important to talk about that as well. If you're looking for a sign to stay alive, you have just seen that sign, and you will see more signs down the road.